Good evening to all the viewers who are watching live and will be watching on the recorded version. This is me, or Mukherjee, your IT manager. Came on to the on this video screen after a long time. So basically, just few things I want to talk about. Don't click on the participation link since it has been crashed for some reason. We were trying to do some clear the issues for technical snag, and the link has been gone off. So we are coming trying to create another new link, and we will soon notify in our next CME. So if you have came only for the only for the participation certificate, then I would suggest you to please change your mind and just listen the topic. So without wasting any more time, let's just jump into 30 seconds countdown time.
Good evening, sir,
Good evening.
and good evening, all the viewers across the globe. And we are having a very proud day today, like slowly and steadily and with lot of determination. We are on the 122nd episode. Started long back in 2020, continuing on with the online continued medical education program is a very challenging job. Moreover, we are a person from education. We are from National Institute of Homeopathy, and NIH Alumni Association is doing a lot of works to promote, propagate, and establish homeopathy and reach the masses. So we have two very important announcements. First, to start with our online journal, I'll request our respected President, Dr. Narayan Kalyani, sir, please speak a few words about Saturday Audi.
Thank you, Bidyut. Dear brothers and sisters, alumni of National Institute of Homeopathy, you might be knowing that we have one e-journal, Repertory. It is running for since last alumni meet, and the articles are very fantastic. But recently, the journal is suffering from scarcity of articles. So it is earnest request to all of you to supply articles, either writing or case presentation or documentation. There are different categories of areas of this publication. Anything which is suitable for you, what you have already achieved, without taking much strain, if you can forward this to the journal team, that will be a great help by which we can continue this journal smoothly, normally. With the intention that these journals should be the best of the world, because best possible brains are within this, among these alumni organized, especially in the field of homeopathy. So it is our earnest request to make the journal update international standard, and all of us must try to keep this journal to this up to the standard by providing articles regularly, by which the journal can run regularly, which will help every one of us. Please try for these journals by giving articles. Thank you.
Thank you, sir. And another important announcement is that we are going to have the Alumni Meet 2025 to commemorate the 50th anniversary of our beloved alma mater, National Institute of Homeopathy. Way back in 1975, National Institute of Homeopathy was founded and had gone through a lot of challenges. But at last, on 2025, 12th of December, with an proud alumnus at the helm of affairs as the director of National Institute of Homeopathy, we are going to celebrate the 50th anniversary of our beloved alma mater. So, all the alumni across the globe, do mark your calendar Please make yourselves available on that day, because 50 years of our national institute from where each and every one of us belong, be it a Deepanage 12 batches course or a continuing 31 batches plus of BHMS course and 24 batches plus MD course. So all the people, almost over 2000, already had studied in NIH and now are proud alumnus of NIH, do gather in Salt Lake NIH campus on 12th of December. And we'll be waiting to welcome you all and to have a wonderful day together to celebrate the 50th anniversary. We'll now move on to our 122nd CME session. We have a very young team to address to all of you. To start with, we have the inaugurator from the 12th batch of BHMS from NIH, Dr. Abhinandan Ganguly. With the permission of our beloved president, may I call Sir Dr. Abhinandan Ganguly on the live stream.
Yes, please call him. Let us start.
Thank you, sir. Also, please bring Dr. Abhinandan on screen.
Hello. Uh, Good evening, Bidyut
Good evening.
and Dr. Devnaran sir. Very good evening to everyone, and I am welcoming all the viewers, to the online 122nd CME by National Institute of Homeopathic Alumni Association. And this evening, we are going to learn on some homeopathic approaches to the disease of children, which will be discussed by my beloved batchmate, Dr. Amit Sahani, 12 batch NIH UG, myself also from 12 batch NIH UG, and uh, today we have another good personality in the world of homeopathy, Dr. Rajat Kumar Pal. He is now presently professor and head of the department of case taking and repertory of DND Homeopathic Medical College and Hospital, Kolkata, and followed by the speaker, who is my batchmate, ex NIH 12 batch, Dr. Amit Sahani. He is presently associate professor, Department of Repertory, R.B.T.S. Government Homeopathic Medical College and Hospital, Bihar. Nowadays, he has become a very famous and regular speaker on the field of homeopathy. So let's listen him, what is his experience and what he has achieved during his teaching life. He is going to share his views, and we should learn all these things. So I am referring my microphone to Rajat, means Dr. Rajat Pal, to proceed the seminar forward. Thank you.
Thank you, Abhinandan. Very good introduction. Respected Bidyut seniors, and along with all the seniors, my respected all my teachers of National Institute of Homeopathy from whom I have learned, esteemed colleagues and dear friends, a very good evening to you all. It is indeed a privilege for me to serve as a moderator of this session of the 122nd Continuing Medical Education Program organized by our association, that is NH Alumni Association. The topic before us today is homeopathic approach to the disease of children. Is one that touches both our professional responsibilities and our human compassion. Children are not just small adults, they are delicate beings in the making, requiring special care, keen observation, and individualized treatment, all of which align perfectly with
the principles of homeopathy. To guide us through this important subject, we are honored to have with us Dr. Amit Sahani. Already have been informed by Abhinandan. He is now associate professor in the Department of Homeopathic Repertory and Case Taking, because this is the now new nomenclature of our department. It is the Homeopathic Repertory and Case Taking, and he is also taking bear of the pain of as a academic in charge at R.B.T.S Government Homeopathic Medical College and Hospital, Bihar. Dr. Shani, Amit Shani, is a son of our teacher. He is Dr. M.K. Shani. Dr. Amit is a dedicated academician, a skilled clinician also, and an inspiring teacher. His experience in managing the pediatric conditions from developmental and behavioral disorder, and maybe he may show the some skin problems and other childhood ailments, has earned him high regard among the peers and the students alike. So now, without further delay, I now invite Dr. Amit Chani to share his insight and clinical wisdom through his lecture on homeopathic approach to the disease of the children. Now, Dr. Shani, now the floor is yours.
Thank you so much, sir, and thank you for a very nice introduction. So thank you, Dr. Rajat, sir, and Dr. Kalyani, sir, President of our Alumni Association, Dr. Bidyut Mukherjee, sir, General Secretary of our association, and special thanks to my batchmate, Dr. Ganguly, for giving a very beautiful introduction of me. So thank you, everyone, and I once again thank Neha for giving me this opportunity, for this wonderful opportunity for presenting my topic, a homeopathic approach to diseases of children. So without wasting time, and I'll start with the presentation, and I'll start my screen sharing. So, is my screen visible? Arko? Is my screen visible?
Sir, I guess still now it's not visible.
Okay. Okay.
No, sir, your screen is yet to be visible, sir. So
Okay.
basically, let me just tell you. Can you see the computer screen? Computer screen with a plus sign.
A computer screen with a plus sign. Yes, I am doing that only. I'm doing that only.
Just do that once, and then click on the slides and PDF, if possible.
This entire screen I want to share. So it's.
Yes. Click on the entire screen and just do it. It's now showing up.
Okay. Thank you so much. Thank you, Arka. So thank you once again, and I am starting with my topic: homeopathic approach to diseases of children. The birth of a newborn. Now, it is an extraordinary moment filled with joy and anticipation. Every parent, they are very happy with the birth of their newborn, but this this comes with an added responsibility. Caring for the newborn, it requires knowledge and patience, and every parent wants to give the best. And it's a slow learning process. The first weeks, the months, they are very critical, and the parents, they slowly and gradually they go on learning about how to understand the well-being of their child. The child comes into this world with trust and innocence, and we need to cater to the child's trust, and give him the best what we can do. And this is what every parent aspires for. Generally, children
Sorry,
and
sir, to
babies.
interrupt. Sir,
Yes,
sorry to
please, Arka.
interrupt.
Yes,
Basically, sir, I am extremely sorry to interrupt.
please, Arka.
Basically, uh, you didn't share the entire screen, sir. You just shared only the tab version. So that's why it's like crossed
Only the
out.
first screen is still
Just
there.
do the process again and click.
Okay.
Only the screen
Okay.
is showing up, because that's why I'm talking.
Uh-huh.
Just cancel it out,
Okay.
first of all.
Stop
First
sharing.
close it
Then
out. Stop the
yes.
share screening for
Yes,
once.
I have. Huh? Then.
So now just go to the plus button again. Then click on
Yes.
the share screen.
Okay. Then share screen message is there. Then I have to share my entire screen. Entire screen is the option that I should choose. No, Arka.
So can you see it's written entire screen on one side?
Yes, entire screen, but there is the share option is not being highlighted.
Sir, now you can see. Now you can hear me, sir.
Yes, I'm hearing you. I'm hearing you. Yes.
So basically click on the entire screen, and then after clicking that, then what you are seeing on the highlighted version, just click on that highlight and then
Uh-huh.
share, sir.
But Arka, this share button in the entire screen window is not visible, not highlighted. Only the cancel button is highlighted.
Sir, click on the screen you are seeing currently on that mini version, the mini version of your screen. Click on that
Okay.
first.
Okay.
Then the share button will pop up.
Okay. Is it visible now? It's still not.
It will take time. Still not. It will take time. Just give some time.
Mm-hmm. Okay.
Sir, am I audible? Sir,
Yes. Yes, Arka.
sir, your share screen still hasn't been processed.
Mm-hmm. I've even added my presentation. Still, it is processing it. Uh,
Then let's just wait. Sorry to all the viewers. It
mhm.
will take some time. Please hold on. It's uploaded. Now you can just start.
Hmm. So thank you, and sorry for the delay and the interruptions. Uh, so I was speaking about this fact that every child is born into this world with joy and anticipation. It's a very joyous moment for the parents, and as far as the caring part of the child is concerned, is it visible, Narka? Now the slides are visible, Narka.
Yes, sir. Yes, sir. Yes, sir. It's visible, sir. It's
Okay,
visible.
okay. Okay, thank you. So, the birth of the newborn is an extraordinary moment filled with joy and anticipation. And as far as the caring of the newborn, it requires patience and attentiveness from the parents. And it's a very slow and a gradual learning process for the parents. The child, it comes into this world with trust and innocence, and we need to cater to that trust. We need to be very much patient with the child so that they are brought into this world with the utmost care, and we are able to persevere the innocence of the child. Generally, it is a well-known concept that children and babies, they respond very well to homeopathic treatment, as they have not been exposed to much as they have not been exposed to much conventional drug therapy as adults. So it's a very much accepted fact that the children's, they respond very much well in comparison to the adults, because they have not been exposed to the chemicals, the drugs, and the medicines that we are exposed to continuously. So this is one of the reason that the children's, they respond very well to homeopathy. And as a homeopath, we can understand that parents' anticipation that they want to give the best for their child. And as homeopathy can also help to strengthen the child's natural defense and immunity, helping to restore a state of good health. Now, Dr. H.A. Roberts, it is an abstract from his book. He says that theoretically, if we could have the child under homeopathic treatment right from birth, and if we could govern the diet, hygiene, and environment as well, there would be very little adult practice left for us. So the excerpt from the book of Dr. H.A. Roberts, the Principles of and Practices of Homeopathy, it is written, he has said that if we are able to take care of the child right from birth through homeopathic medicines, there would be very little practice in the adults left for us. The rise in the childhood disease is a multifaceted issue, with factors like malnutrition, poor sanitation, inadequate healthcare access, environmental hazards, emerging and re-emerging life diseases and lifestyle factors. So we have to understand the fact that why do child they become sick, they become ill. So number of factors are responsible for it. Now we have to deal with the factors like malnutrition. Then we have to deal with factors like emerging and re-emerging diseases, and the pollution, of course. Now there is a trend for the re-emerging of the diseases among all of us, including the children's, and this is one of the biggest factor that is responsible for the rise in the childhood diseases. And as far as the children diseases is concerned, the study of diseases of children is one of the most fascinating subject of medicine. Practice among the little folks is a part of the character of the conscientious and the painstaking physician. The children are unable to communicate their distress in words, and it becomes imperative for the physician to study their language of pain and disturbance, of function, and to interpret the tale of sorrow and their signs of anguish. So as physicians, we have to understand that the children, they want to come up with subjective symptoms. The observations from the children, they form the key through which we can interpret the most and frame the totality of the symptoms, and thereafter we can prescribe the best for the child. So as physician, as homeopaths, we have to keep our sense organs open so that we can perceive. And this is what Hahnemann meant, that we have to perceive about the diseases, the changes, and that these changes in these small ones, they can be perceived only through the objective symptoms. So when it comes to treating children, the parents, they wonder which approach is best, because every parent wants the best for their child. And homeopathy, it becomes as a natural choice. It becomes a natural choice for the parents, because we have a tag associated with us that the homeopathy comes with no side effects, and every parents, they want a system of medicine which should be able to cure their child but without any side effects. And this is where most of the parents nowadays, they are opting homeopathy for their children. Homeopathic remedies, they are highly individualized and are chosen based on person's unique symptoms and overall health. Homeopathy is effective in treating a wide range of conditions, including acute and chronic illnesses, allergies, and emotional disorders. So, as homeopathy is has a very wide scope of treatment, the treatment of the children, it becomes quite more important, because the individualization in the children, they becomes very much apparent through the totality and the observatory symptoms that are observed through the parents and the child. The differences between the conventional and the homeopathic treatment is that conventional system of medicine, it focuses on treating the specific symptoms of the disease. On the other hand, homeopathy takes into account the whole of the person including their physical and emotional well-being. So homeopathy definitely has an upper hand and over the conventional treatment, because it gives importance to the totality of the symptoms of the patient. It considers the patient as a whole. So the holistic approach of homeopathy is definitely makes it a preferred line of treatment for everyone, and more so in the children's. Now the reason again why homeopathy. There are many ways in which homeopathy can be of service in the treatment of the children. Homeopathic medicines are known to be useful for a number of conditions related to the children and adolescent, and the treatment is without any side effects. The medicines are palatable, and acceptability and compliance to the treatment is very good. So it becomes a system of choice for the parents. Furthermore, an understanding of the place of homeopathy in the pediatrics and also in the other branches of medicine can be achieved by appreciation of the meaning of the holistic approach. The holistic approach to the pediatric care is based on the principle that the body has and the inherent ability to heal itself. So the concept of vitality and the stimulation of the vitality with vital forces through our natural medicines, through our medicines which has been well proved, it makes it an appropriate choice, and the concept of the holistic treatment is very much embedded in the meaning. Homeopathy has gained popularity over the years as more and more parents seek natural alternatives to the conventional medicines for their children. Now coming to the pediatric case taking. Pediatric case taking requires case taking which demands accurate observation from the physician, because as I said, the subjective symptoms, we are at lack of subjective symptoms. So we have to depend all the more on the observations. So pediatric case taking observation is the key, as questions during the case depends on the observing the behavior of the kid. The observation gives more data about the children than the children themselves. Sometimes, or I'll say most of the times, the history of the mother also works as the guiding anchor. So we have to altogether give more emphasis, more focus on the observations of the symptoms from the observations which are coming from the parents, and the history of the mother. So coming to the literature part of this pediatric diseases and homeopathy, there is a book by Dr. Praveen B. Jain, Essentials of Pediatrics, published by B. Jain Publishers only. So it gives emphasis on the 3 points for the art of the case taking. The first point is observation, then interpretation, and thirdly, confirmation from the patient. So the emphasis on observation we have already talked of. So we have to give more stress to the symptoms which are coming from the observations from the physicians, observations from the parents as well. Then we need to interpret those symptoms. Now, whether our interpretations of the observations is correct or not. And thirdly, we need to confirm our ideas through the parents. So what we are thinking about the particular complaint, the observation from the patient, whether it is actually in the way we are thinking of it or it is something otherwise. So we have to give emphasis on this thing also. Now I'm bringing another literature from the pediatric literatures of the homeopathy. So this is the Bringing Up Healthy Children with Homeopathy by Dr. Banu D. Desai. So this book, number of things are written, but what I want to highlight here is the importance of the mother for the confirmation. So mother is usually the most reliable person to provide the necessary details, as she watches the child more closely, and most of the time she is watching the child. So she has watched the child through every phase of the life. She has watched the child. The mother has watched the child very closely through all the phases of the life. She has watched the child grow. She has watched the child cry, laugh, So she knows how and when the child will laugh, how and when the child will cry. So and the mother, she is the best source where we can confirm the symptoms, where we can find, where we can go for most of the symptoms from the about the patient. So she is the one who will provide most of the definitive symptoms about the child, and most remarkable symptoms about the child. Then this book, very highlighted book, very important book in the homeopathic literatures, a handbook on diseases of the children and their homeopathic treatment by Dr. Charles C. Fisher. This is a very exhaustive book, a very detailed literature on the pediatrics aspect of our homeopathy. So this book highlights the connection of the mother with the unborn child. The importance of the intrauterine history has been emphasized in this book. It's an extract from this book. It says it should be remembered that after all, this is not very wonderful, for until born into the world and separated from her offspring, it is really a part of the mother, living within her, being nourished and sustained by her, and by means of placental attachment to the uterus, being really a part of her anatomy for the time. So this book emphasizes that before the child is born, the child is a part of the mother's anatomy and very much influenced by the mother. So definitely the intrauterine history will be very important aspect that we have to emphasize upon, and so that we can get some meaningful symptoms, some very important symptoms through which which can guide the case. And this small book by Dr. D.M. Forbister, now Homeopathy and Pediatrics. This book emphasizes upon the role of homeopathy in emotional and behavioral problem of the children. So how the emotional pattern and the behavioral pattern of the children, they help us to find out the medicine, what are the factors which we can emphasize upon. And so it has been highlighted in this small literature of homeopathy. Now, being a teacher of repertory, I'll come to the repertorial approach, and homeopathic repertory has kept pace with understanding of pediatrics cases, and the evolution of the rubrics related to children can be seen in many repertories. We have a number of repertories which deal with the problems of the children. Even the mental symptoms of the children, the psychological symptoms of the children are seen in many of the repertories, including our this Kent repertory. But one repertory that I will like to mention worthwhile here is the Homeopathic Medical Repertory by Dr. Robin Murphy. So this repertory was published in the year 2009, and it has 74 chapters. So children is one of the chapter in this book. Among this 74 chapter, it is the 12th chapter, the children chapter, and there are 203 rubrics in this chapter. Now, coming to some of the very some interesting rubrics in this chapter, children chapter of this Murphy's repertory. Now we have got some diagnostic rubrics like acromegaly, adenoids, asphyxia of the infants, autistic children, cretinism, Down syndrome, hernia of the infants, intussusception, spina bifida, pneumonia of the infants, marasmus. And then we have some constitutional rubrics like abdomen general enlarged, dwarfish, feminine boys, delicate and puny sickly children, hair growth on child's face, masculine habit of girl, thin sickly children, birthmark nevi, and then mouth pale wrinkled, obesity, weak children. Then we have got some rubrics related to the this milestones and the growth related rubrics. Now, so we have got rubrics like curvature of the spine, curving and bowing of the limbs, dentition difficult, teething, developmental delayed or arrested, open fontanelles, growth disorders, growth too fast, head infants cannot hold up, knees knocked together, walk general late learning to walk, learning disabilities. Then we have some ailments from rubrics also in this chapter, and ailments from abused being in general, ailments after embarrassment, ailments after artificial food. So these are some artificial food. It is one of the coming up problem because of a lot of dependency upon the artificial food. Then we have ailments from fright, ailments from homesickness, ailments from jealousy, ailments from punishment, ailments from hair cutting, ailments from vaccination, ailments from domination by others, ailments from nursing breastfed children. Then we have some habit related rubrics also, and biting fingernails, destructive behaviors, finger in mouth child puts, lips picking off, jumping chairs, tables, stoves, masturbation children in, striking, hitting behavior, shameless behavior. Then we have some CNS rubrics, related rubrics. So convulsion in children, convulsion in infants, incoordination, insomnia, sleep infants, nightmares in children, paralysis of infants. Then we have some mind rubrics, and abusive children who insult their parents, desire to be carried, clinging, child awakens terrified, confidence, lack of self-esteem, conscientious about trifles, cruelty, cannot bear to see cruelty, quiescent, child cannot be, strangers, presence of aggravate, washing, aversion to bathing, startled easily, hide desire to. Then we have some general rubrics, and like childhood diseases, absent or too late, chill of infants, edema in newborn, emaciation of children, fever constant in infants, muscles weakness, sour smelling infants, urination painful, child cries, urination retention in, chafing of the skin, lice in general. So these are some of the rubrics, and they seem more appropriate for the current times, especially because we have got so many rubrics which are related to the lifestyle disorders. And the coming up challenge for all of us as homeopaths, all of us as physicians, first of all, is the lifestyle disorders, which is becoming a major challenge to us. So with all these literatures, and I would like to show some of the cases from my OPD of my college. Now, so first one is a case of autism. So this is a case of a 2-year-old child who came to our OPD last year in the 9/5/2024. The parents complained that there was lack of eye contact even with the parents. And the child was aversion to answering. The child would not reply. I have a video, but I am not able to share because the screen sharing problem. But that you can see that the child, it is seen there in the video that there is a aversion to answering. The child is not giving any attention to the interviewer or even to the parents. Is just wants to be in one of the corner and cutting all the eye contacts. Inquiry from the parents, they told the milestones, they were on time. The walking, teething, speaking, everything was on time. But they also said that the child was also hyperactive and sometimes restless and wants to run away. Likes traveling with father on the bike, and also has the habit of handling the genitals and hitting back on the head and licking the wall. So this was the information that came from the child's parent. So primarily we saw that the child was having poor eye contact, and this is what we were concerned for, because in our college we are running a special unit for the autistic children and autistic and the ADHD children. So we took this child to that unit, and the scoring pattern, the scoring for the autism was also done, and the totality of the score came to 130, and which made it a case of moderate autism. And I'll be showing the score sheet also in the coming slides. So coming to the intrauterine history of the child, because emphasis on the intrauterine history should also be given. So this was the first live birth of the child, and with the mother having history of 2 abortions. So full-term delivery by cesarean section was done. Earlier history of abortion in the mother was due to the twisted cord. So this is what the mother said, that she had earlier 2 abortions, and that was primarily because of the complaints of the twisted cord. And during this pregnancy with this child, during pregnancy, the mother was in stress because mother-in-law used to taunt her about previous abortions. And so this, because of the history of the abortions, the mother-in-law used to taunt her, and this used to give her all the stress. And also the mother's elder sister, she died, and so that grief was also there. So altogether, we can see that in the history of the intrauterine history of the child, there is a history of grief in the mother, and which makes it very much prominent. On inquiry upon the family history of this patient, now the father had no abnormality. Mother, she was suffering from hypothyroidism, and she was taking allopathic medicines for it. So maternal grandfather, he died of cancer, and the grandfather was suffering from diabetes mellitus. So that was all from the family history side that we could collect. From among the further history of the patient, the physical generals, what was analyzed, that appetite was quite adequate. The child had desire for salty food, and no aversion as such. The thirst was also adequate, and little bit of constipation was there, but the stool was not satisfactory, but consistency was normal, and there was no peculiar odor. Urine was clear, and no odor was there. And perspiration was also not very much marked. It was mostly during the summer time, non-offensive, and no staining. Now this is the seat I was talking of. This is the Indian scale for assessment of autism, and we follow it for the screening of autism in our autism clinic in our OPD. So as I said, the totality of the score came to 130, which makes it as a case of moderate autism. And because 107 to 153 falls under the score of 107 to 153 falls under the case of moderate autism. So this child was clinically diagnosed as a case of moderate autism. Coming to the repertorial analysis of this child, and I repertorized this child, this case, using this synthesis repertory using the radar software, and the rubrics that were taken for this case was answering aversion to answer, concentration difficult children in, restlessness children in, striking himself, energy excess of children in, family history of cancer, and family history of diabetes mellitus. So all the evident symptoms, and which goes behind this child was taken for repertorization. The rubrics were taken, and the result, the repertorial result, had source for phosphorus as that covering the totality of the symptoms. But however, carcinosin, it is coming in the second line, and I'm covering 6 symptoms, missing only the striking himself rubrics. And then there are, of course, the other results, other remedies which are following, and lycopodium, opium, tuberculinum, hyoscyamus, medorinum. They are all following the repertorial analysis. So primarily it was the phosphorus which was covering all the symptoms. So we started the treatment of this case with carcinosin 1M, considering the long-standing grief that the mother had been subjected to, and during the course of her pregnancy with this child. So we started this case of with this medicine carcinosinum 1M, 1 dose, and then placebo was given twice daily for 1 month, and the patient was asked, the parents were asked to bring the child thereafter. So this is the follow-up sheet. The parents again came 2 months later on 16/8/2024, and they said that the eye contact was still poor, but a little bit improvement in the restlessness was noted. The handling of the genital was also a little bit relieved, and the child had now interacted with other children. A little bit interaction was also there. So we went back to the first medicine. We prescribed phosphorus 1M. Only 1 dose was given, and then the second follow-up was done on 18/10 in the month of October. The feedback was the patient was doing well. The eye contact also had improved. I have some videos where the child is able to, the cognitive skill of the child has also improved. He's able to catch the ball and able to count and put the objects into the basket. So we have videos, but unfortunately I'm not able to share here. So the patient was doing well. The eye contact has also increased. The restlessness was better, wants company, and holding of the genitals was also better. So we didn't give any medicine, only placebo was given. Then again in the month of November, another child came, and the parents complained that the child was knocking again on the door, licking the walls, rolling on the floor, weeping suddenly, laughing suddenly. Was better in all these complaints, but this month the complaints had reappeared. So we once again repeated this medicine, phosphorus 1m. And in the month of January this year, there was improvement in the licking of the walls. There was a sudden gust of energy, laughing, holding the genitals. There was improvement in restlessness. But as long as the improvement was continuing, we kept up with placebo. And in the month of February also, there was the patient was overall better. There was the eye contacts had also increased. He had also started speaking some words like Didi, Papa, and then also wanted to play with other children. So we kept on with placebo. But in the month of March, there was again hitting back on the head, and on being scolded, he used to reply. He used to try to make loud voices. There was blinking in the eyes, chewing clothes. So we once again repeated the medicine, phosphorus 1m. So next visit was in the month of March. So there was overall improvement, and the patient is continuing till date with us. And all the videos they show the overall the child is improving with the cognitive skill, in the development of the cognitive skill, and overall having more and more betterment towards this towards the course of the disease. So this is one case that I showed you. Now we have another case from our OPD. This is a case of discoid eczema, and a child of a 14-year female child. So she had complaint of round itching eruption with cicatrices that tend to open repeatedly on the dorsum of the left of the hand for 6 months. She was suffering for this complaint for the past 6 months. There was severe itching and often burning with thick yellow discharge. So as other associated complaints were that there was itching which was aggravated by heat and warmth of bed, scratching with more on washing with cold water, pain in the abdomen, especially in the umbilical region in the left iliac fossa, aggravated during menses, ameliorated by lying on the abdomen since menarche and during every cycle. In the past history, no abnormality was detected. In the family history, the grandmother, she suffered from joint pain. Among the physical generals, it was seen that the patient had a liking for salty and the spicy things. Urine was sometimes burning, but there was no odor. Tongue was white coated. Perspiration mostly on the face and the neck region and non-offensive. Thirst was less and appetite was also less. Analyzing the life space of the patient, I have to explain that she was a student and she has an extreme desire for company and she cannot bear to be alone. When she was asked about any fear, she replied that I am afraid that the disease will worsen and become dangerous to an incurable disease. Now she is a child, a small child, 14-year-old, and having some eruptions on her eruption complaints. And she's having the idea that her disease will increase to an extent that it will become incurable. So this is a big thing that we have to consider. Then she is not able to make decisions, and when any decision is needed. She is very sensitive to the light weather. It's sunlight or very bright artificial light immediately causes a feeling of discomfort. So she is also very sensitive to light. The physical examinations, everything was quite normal. The height 4 feet 8 inches, weight 38 kgs. Appearance, the complexion was tall, dark, lean and thin. No cyanosis was there. So miasmatically we analyzed most of the symptoms which correlated with the psoric character of the had a psoric character, especially the mental symptoms. They were showing more of the psoric character, and the physical symptoms, of course, the eruptions and the eczema, they had a psoric character. So again, the repertorial analysis of this patient I'm sharing here with you. So desire for company alone aggravate, fear of impending diseases, irresolution, sensitive to light. So these are the 4 mental symptoms that we collected from the child. Then abdomen pain, lying on abdomen ameliorate, abdomen pain, menses during, skin cicatrices break open, and eruptions discharging yellow, eruptions eczema, itching, scratching ameliorate. So again, this became a case of phosphorus after the repertorial analysis is shown to us. It becomes a case of phosphorus followed by calcarea and arsenic. So phosphorus, gets the highest mark in this repertorization, followed by second place calcarea carb. Now, so considering the totality, and we gave phosphorus to this patient, and considering that it is covering almost all the symptoms. Phosphorus 200, and a 4 dose was given for twice daily, and this placebo was given for 1 week, and the patient was asked to report thereafter. So we can see the progress through the pictures. Now, so how the progress, what was the level at which the patient came to us, and how the patient gradually improved in the course of the treatment after a few repetitions and giving placebo to this patient. Now, so finally, in the last slide, we can see that there was complete this completely erased. Now, the marks were completely erased, and there is no signs of the disease itself. So the follow-up, first follow-up was on 10/6/24. Now we see that the itching complaints was reduced by 20%, and the exudation also reduced by 10%. Now the pain in abdomen was also better, and no new complaint was found. But we repeated with this medicine, phosphorus, and 1 once again. And then in the 6th month, again, there was improvement in the complaints. Only placebo was given. Then again, in the month of July, there was improvement in the overall complaints of the patient, and it was followed by treatment placebo only. Then we had further follow-ups where we once only repeated the medicine because there was a little bit of stagnancy in the progress of the patient. And later on, through the further follow-ups, which we can see it on the screen, the itching complaints and the other complaints which the patient had came for, and it gradually improved, and which we have also seen through the photographs also, that the eczema portion of the skin, it becomes gradually improved, and the complaint completely disappeared in the month of September in 2024. So that was almost a cured case for us. So this then we have another case of pityriasis versicolor. This is a case of 6-year-old male child. Dry, itching, scaly, hypopigmented patches all over the body, especially the scalp region, often alternates with some hyperpigmented macules since 2 years. Severe itching aggravate at night, heat of the sun, warmth of the bed, ameliorated by bathing and washing the affected parts. So that was the patient for us. So the other complaints were that there were reddish discoloration of the patches with some red papillary eruptions after a scratching of the affected parts. The complaints aggravated more while being exposed to the heat of the sun and increased perspiration. Although having good appetite, the child has emaciated constitution and health does not grow properly. So in the past history, no abnormality was detected. In the family history, the grandmother, she suffered from eczema. Analyzing the physical generals, there was desire again for salty things. The child was constipated, having irregular bowels. Urine was quite okay. The perspiration was mostly on the scalp and especially on the uncovered parts of the body. Thirst was less, appetite was less, the tongue was coated, and the sleep was disturbed. Analyzing the life space, the child was a school-going child, was very frightened easily, had consolation, which was aggravated, which aggravated the weeping complaints of the patient, was very much sensitive to noise, and was obstinate also. The physical examination was all quite okay. The average fair complexion, no cyanosis, weight was 18 kg, and height was 2 feet 7 inches. So the miasmatic analysis of the patient, which we can see here. So the overall dominance of the SORA. Now in this is skin complaints. Sensitivity to noise again falls for SORA, and some complaints of course go for syphilis, but overall it is a case of dominated by the SORA and other symptoms of the patient also. And so the miasmatic analysis of all the symptoms of the patient were done, and it was a case which was predominated by SORA. Now considering the repertorial analysis, coming to the repertorial analysis once again. So the mind was sensitive to noise, weeping, consolation, aggravate. So these two mental symptoms we took for the patient. Skin discoloration red, scratching after aggravate. Skin eruption pityriasis versicolor. Skin eruptions scaly. General bathing ameliorate. Emaciation in children. Desire for salt food, and sunlight aggravate. So the first medicine which is coming up in the repertorial analysis is Netramur, although it is not covering the rubrics pityriasis versicolor. The provisional diagnosis of the child was pityriasis versicolor, which we can see in the subsequent slides. I want to show here that Netramur is covering all the totality symptoms, but it is not covering the pathology, which is also mentioned in the synthesis repertory. But and it was followed by other medicines like sepia and calcarea carb and phosphorus and several other medicines. So after repertorization, Netramur, it gets the highest mark, and on second position was sepia. But after analyzing that the symptoms and considering the Metra Medica, Netramur was selected as the best similimum for this case. The reason was that we ignored this pityriasis versicolor because the totality was going in favor of the patient. Netramur was going in favor of the patient. Overall, the child reflected the symptomatology of Netramur. So Netramur 200 was prescribed in 6 doses twice daily, and placebo was given for 1 week. The child was asked to report thereafter. So this is the photograph of the child now before and after the treatment. So in the second photograph, you can see that all the patches on the scalp, they have gone after the treatment, after the prescription of the Netramur. So follow-ups. So the first follow-up, the patient improved by 30%, and the eruptions had also improved. So we gave nothing but placebo. But in the month of July, the itching complaints had improved, but a little bit of stagnancy was felt, and Netramur 1M was given to the patient. And thereafter, in the subsequent follow-ups, there was complete improvement, and finally on 13/8/24. The photograph which we have shown there, so it was completely disappeared, and we kept on the patient with placebo with only 1 repetition of Netramur. So these were some of the cases that I had kept here for discussion. So the highlights that we want to take up among all these 3 cases, that we have to find out the mental symptoms. We have to analyze the mental symptoms from the patient. Now, most importantly, in the second patient, what we could see was that the patient was let me go to the slide. And yes, so she had a fear that the disease will become incurable to an incurable extent. So this is very important for the child. So overall, the mental symptoms of the patient and also the physical symptoms of the patient should be given importance in respect of the pathology. Although different repertories, they are coming up with the pathological terminologies, which I have already shown you from the Murphy's repertory also. Now, considering the future prospect of the treatment, future prospect of having using homeopathy as a system of medicine for the treatment of the children. So as I already discussed, that there is a growing awareness among the children, among the parents, about this homeopathy. They consider it as a safe pediatric option, and are considering the fact that homeopathy, it comes with a tagline of no side effects. Integration into the public health programs. We have many states which are following this national health mission and having this Rashtriya Bal Swasthya Karyakram, and homeopathy and homeopathic doctors, they are being introduced into the circle, into the stream. They are being brought into the mainstream, but it should be brought in with more efficiency, and homeopathic medicines should be provided to them, so that integration will help homeopathy to show better results among the childhood diseases. And of course, one of the vital areas where we are lacking is lack of publications and the research works which will help to validate the effectiveness in the pediatric care. So this is one very important area where we need to work upon more. And many of the institutions, they are doing very remarkable work in this direction, because focus should be done, emphasis should be given in this direction. So I'd like to conclude here that with the holistic approach, homeopathy, it plays a very crucial role in the pediatric healthcare. It provides safe, effective, and long-term solution, ensuring the overall well-being of the children. As demand for the natural and the gentle treatment rises, homeopathic role in pediatrics will continue to expand significantly. So thank you everyone for a very patient listening, and I once again thank our National Institute of Homeopathy Alumni Association for giving me this opportunity today's evening for giving my presentation. And if there are any questions, please, I would like to hand over the session to our Dr. Rajat Kumar Pal sir, so that he can go on with the proceedings. Dr. Rajat sir. So if any questions from the audience are there, please share it in the comment section of this session, so that we can I'll be able to answer. Dr. Rajat, Dr. Arka. So I request once again our moderator, Dr. Rajat Kumar Pal. Sir, please take up this session.
Hello, am I audible?
Yes, sir. Yes, sir.
Okay, it's a very good, nice presentation, Dr. Amit.
Thank you, sir. Thank you, sir.
On behalf of the NH Alumni Association, I take this opportunity to express our heartfelt thanks to Amit again for his thought-provoking and comprehensive presentation on homeopathic approach to the disease of children. Your lucid explanation on autism and pediatric skin disorders has not only reflected your vast clinical experience but also reminded us of the depth and scope of homeopathy in pediatric care. The way you combine the classical principles, explanations, you have shown the pictures, some videos you cannot show due to some technical issues. Clinical insights will certainly enrich our understanding and help in the better management of these sensitive cases. This being the 122nd CME of our association, it is indeed fitting to have such a relevant and enlightening topic shared with us. I am confident that all present here will carry this learning into their professional practice, benefiting countless young patients. And you have shown different area of our repertory, mainly the our Murphy repertory. Particularly, you have given the stress on the chapter for the children. It is mentioned in the Murphy repertory, and you have grouped different. That means the other constitutional, behavioral. In that way, that is very good endeavor. I think the viewer, those who are not using repertory in day-to-day practice, they will start to practice from your lecture. Also, you have shown the how the pathological rubrics are mentioned in the repertory, the milestone and growth related, PNS related, and mind rubric and general constitution rubric. Yes, so different repertories are there. It is my request, from as we are from a speaker and myself from the department of repertory, all the viewers, please request from our end, please use repertory. It is a fantastic tool. It will help a lot when you are not getting any medicine for your particular patient. Then your repertory, very good general repertory, always help you. So that area also, uh, you have emphasis in your lecture, and you have shown the one case of the autism and the two cases of the skin disorders. So being a moderator, I want to add few of that. I think so, because within a very short period of time, every part of the pediatric diseases cannot be touched. One book I have, that is Homeopathy in the Children Disease by Dr. Esar Wadia. Very small book, that it was published by Dr. Wadia, and it is nothing but the paper presentation at the scientific session of the International Homeopathic Medical Congress at Delhi in 1977, and that was published later on. Only two to three things I want to share, because I think that is relevant to this discussion. Achalasia of the cardia. That means the lower part of the esophagus is not expanding properly. So, child, whenever he takes or she takes something, after a few moments, it is coming out. And and he mentioned many things has been mentioned, but I am giving the few snaps of that. The phosphorus is a very good medicine, and after that, and dysentery compound, it is have the action on the particular area. For the skin disease, what Dr. Amit has explained is a very good way how the disease have been diagnosed, how the repertory have been done, and how this medicine was selected. With from the homeopathic point of view, everything is fantastic. His explanation. Along with that, Morgan batch we can think of when graphite, sulfur, and sodium have not succeeded. He has mentioned. We are getting the result also. And bronchial asthma he is mentioning, because one book in the PG, that the times of the remedies and moon phases by Dr. CM Boger. If the new moon, full moon aggravation, on patient is suffering from the, if the patient is suffering from the asthma, not the COPD, there may be the new moon, full moon aggravation. The phosphorus and silicea is the top of the list. So in that way, and lastly, I want to mention the enuresis. Nocturnal enuresis is a very burning issues, and reason, if you go through the literature, then we get the different kinds of reasons. Sometimes it is very hard to cure, and he has mentioned Dr. Fobister, and he has our Dr. Amit has mentioned the shows the picture of the Dr. Fobister book. It's a very good book. The Bacillinum testinum is one of the very good medicine we can think of, and psychotic compound. And now Bacillinum testinum given by Fovister, and Dr. Wadia has mentioned the another medicine that is a psychotic compound. So with some glimpse, I have added with Dr. Amit's presentation, because he's tried to cover within a very short period of time, few area of the diseases of the children. So now it is the time for, uh, is there, I'm checking whether any questions is there or not. Dr. Arko, Dr. Arko,
Sir, there
is
is
there?
no question yet, but we
Okay,
can wait if you can want if you want, sir. You can just wait. I
okay,
guess the questions may be after the post CME, maybe. I don't know.
okay,
Many of have joined at the late version, means have joined late after 9.
okay,
So that's why many have what to say. They will watch,
yes,
and it will be best to answer on the comment section to the viewers. If anyone wants to question who have came later on, just watch the recorded version, and if you have any questions, just write on the comment section. I hope Amit Sahani sir will get some time to get with that through. Is it all right, sir?
Yes, yes, surely, surely.
Then it's great. Over to you,
no,
sirs.
okay, okay. So shall I conclude here, or we shall wait for some times? I think if it is in later, some viewers may put some question in YouTube, and already our
Yeah,
Amit, our Shamit, or Amit has
uh,
mentioned the his email, so he can give the answers. So thank
Yes,
you, Dr. Shani, Amit, again for his enriching and well articulated presentation. Your emphasis on careful case taking, repertorial analysis, and remedy selection has been truly enlightening. So we now have some time for questions and discussion, but no questions is there. So uh, allow me to conclude here. So this is now
uh,
I'm concluding, and I'm
thank you, Dr.
transferring
Rajat.
yes, transferring the mic to the our beloved Dada, Dr. Bidyut Mukherjee, is the secretary of the NH Alumni Association.
Thank you, Dr. Rajat and Dr. Amit Shani. It has been an engrossing session through and through. We are having 97 plus live viewers in our YouTube live. And
Not audible, not audible.
yeah, yeah.
Yes,
Now I think it's audible.
yes, yes, yes,
Hello.
yes.
I'll request our beloved President, Dr. Abhinandan Kalyani, to share his views. Sir,
sir, your
unmute.
mic is on, sir.
Unmute করুন, sir.
Yes, sir.
হয়ে
Am I
গেছে,
audible
হয়ে
now?
গেছে, sir.
Okay.
Yes, sir.
Thank you, Bidyut. Our most competent General Secretary. Everybody will accept it.
Yes, sir.
And many thanks to our today's moderator, Professor Dr. Rajat Pal, very close to us, very beloved, and nicely has moderated. Plus, he has added his own experiences. Fantastic moderation. Abhinandan, our junior brother, fantastic inauguration, and we are expecting him to come as a speaker in near future. Thank you, Abhinandan. Regarding Amit, what should I say? Dr. Amit Sahani, Professor Dr. Amit Sahani is our student, and we are student of his father. So we are very proud that one genius homeopathic family is growing. Many, many thanks, Amit. Your presentation is beautiful. And homeopathy is expecting many more from you due to your competence. He is very competent alumni in all respect, and that from his speech we all of us understood. And he has added many things. Most important thing is how to find out the solution of child's disease, literature, procedures, and he has shown some examples of cure. Now, there less I am to add because I do not want to add anything regarding repertory. You the two professors, two brilliant pillars of repertory, one from West Bengal, other from Bihar.
So you
So
may
what
add,
I
you
just
may add.
want to add is that my experiences. Say, as Amit was telling, that parents has become very sensitive regarding their child's nowadays. The reason behind this is simply the child has become more valuable, more costly than before because numbers are less. Families are planned. Naturally, parents having one or maximum two children. Naturally, their full attention on children than anything else in the family. Accordingly, we have to be very sincere regarding every child and their every disease because not only we are treating a child, but also we are treating a family attention, parents' attention. So we have to be more careful than before. Now let me tell you my experience in early life. When I was not a student of homeopathy, school student, but I saw, just I can remember, that homeopathy doctors, they were simply sitting in their chambers in the evening with very minimum number of patients, and patients' appearance, attitude, they are not coming from a very good family, well-to-do family. Rest of the day, the homeopathy doctor is treating patient free in any charitable dispensary. In our locality, Howrah, I have seen in every village there was one charitable dispensary. From morning 9:30, 10, doctors used to see patient free or by taking 10 paisa, 15 paisa as planned by the organization or clubs, and doctors are attending to see patient to gain experiences and gain some field. This was the picture. When I became a homeopathy doctor in Calcutta Homeopathy Medical College, I found that there is 3 gynecologists. Dr. K.K. Roy, very famous in Calcutta. Dr. Monusha Ghosh, Professor Dr. Monusha Ghosh, M. Ghosh, many of you have seen. He was teacher of gynecology in NH2. And Dr. S. Bennett. 3 gynecologists in one homeopathic hospital. Just imagine how much was the craze of delivery, pregnancy, mothers and child. We have seen number of mothers are standing with their children in the OPD. Plus, almost every day, except a few days, there are labors we have seen. We have seen number of labors. To that extent, our hospital had to keep one residential medical officer for this controlling emergency at night and this pregnancy. And residential medical officer was our beloved Dr. Sunimar Sarkar. We had a problem and we had other movement for this appointment of Dr. Sunimar Sarkar as an RX, residential Sarkar. Then when we came to NIH as a classmate, I understood why my teacher selected him because he was brilliant in Mathematica, very daring, very fine decision making. Anyway, then after that few days, I understood that all the homeopathic hospitals, they were very famous for mothers and childs. Pratap Chandra Memorial College was simply grown due to control the mothers and children and delivery. It was very famous for delivery and tackling children. If you go to Calcutta Homeopathy College one day, I was telling that the front building you will see there some maternity ward. Oh, sorry, LV Mitra maternity ward. The hospital front corridor, you will see a nameplate is very engraved name LV Mitra, who was grandmother of Chief Justice Shankar Prasad Mitra of High Court, Calcutta. So before our time as a student and during our time, mother and child was one of the greatest attraction for homeopaths and parents. They used to come to the homeopathy because controlling of pregnancy, delivery, etc. was not that much developed as it is now. This was the history. And people used to say, oh, regarding the charitable dispensary, I'm telling, everywhere, almost everywhere, nowhere you will find a single young boy, nowhere you will find a person who is well dressed, mostly mothers with thatched clothes with a child in lap. They are standing in the queue to collect the charitable dispensary medicine. And they were living on those charitable dispensary, depending on the charitable dispensary, mother and son. Now let me tell you the present situation. This is not a history. It will encourage you. Suddenly one day, at that time, Dr. Ishwar Das was director of NI. One day, Dr. Ishwar Das, our director, called me suddenly. That Dr. Kalyani, can you take one responsibility, big responsibility? So I said, sir, what is that? The government want to campaign throughout India regarding mother and child. Can you take the responsibility? So without knowing anything, without deciding anything, due to my daring attitude, I said, yes. Then he was, okay, thank you. You go, I'll call you later. I came out from his room. I inquired why he called me. There are so many professors, assistant professor, other high post faculty members. Why I was called. Then I came to know that our administrative officer, Mr. Hajra, I came from the office superintendent. Mr. Hajra replied director when asked who is the most efficient person in this institute who can tackle this big situation. So he proposed my name. By listening this, I become more strong that yes, institute is desiring to depend on me. Then I started inquiring how this things has come. I came to know that government of India thinking at that time that India should go to developed country level from developing country to up get up the status of the country in industrial field. For those reasons, for this reason only, to become developed country from under developing country, one greatest criteria is maternal, fetal and child death rate. Until this death rate can be reduced, child, fetal and maternal death rate, India will never be able to go to developed country level from developing country. That was the constant of the government. Then they had a meeting in Delhi, taking all streams, allopathy, homeopathy, Unani, Ayurvedic, all streams, that who can help this to highest extent. In that meeting, it was decided together, jointly, that homeopathy would be best solution for this, which is lacking in the conventional system of medicine, where they are constrained by strong medication. Homeopathy can help a lot. That was decided, and ultimately the work was done, given to the homeopathy ministry, Ayush ministry. Ayush ministry insisted NIH to take the responsibility because number of students, teachers are there, and most brilliant. When I met director, he gave me the plan. I started working with all the states of India. First, I collected all the state top officials of homeopathy as state nodal officer. I was made a central nodal officer of NIH, and state nodal officer will be the health directors, homeopathic directors. Then those health state directors, they will decide their team in the state. So we started having different meetings in NIH. Then step by step, we started proceeding towards seminars first. Sensitization will be the first thing. The procedure will be in every state headquarters, Calcutta, Port Blair, Goa, other state headquarters, there will be a seminar, conjoined seminars by the presence of all doctors, no student. They are allopathy doctors, all specialists from the gynae and pediatrics department, hospital superintendents, chief medical officers, CMHs, they will be the participants and speakers. So from homeopathy, allopathy, jointly we started organizing seminars in different states. It will be astonishing to know, many of you might not be knowing, that from nowhere, not even from a single conventional doctor, we heard any criticism regarding homeopathy. Everybody was inspired, everybody was cheerful, to take the assistance of homeopathy. And every one of them in every way they encourage, please come forward. We want your help. We have to work jointly. On those seminars, mostly was presentation, documentations, and interactions. Some are 1 day, some are 2 days consecutive seminars, since morning 9 till evening, continuous seminar. And guest will be either medical superintendent or state chief head. Head means most allopathic, sincere, higher post doctors should be first sensitized. And it was utter surprise we found that they are already been sensitized regarding their limitations and constraints for the strong drugs for the children, babies, and mothers. So from there onwards, we started working, publication, seminars. Then our program was different colleges, institutions. We performed that level best. This way the propagation was continuing. That's when government decided to put some rural child health officials, medical officers. And you were knowing in West Bengal and other states, many RCH doctors were taken to treat the children especially. So this is the history of the day, present day. Means government himself is feeling that health of the child is very, very important for grow up India from developing to development. Anyway, maybe so that we are not able to satisfy the government. That is why they have, to some extent, they have been constrained to give employment on our state presently. But it is true that it was decided altogether from all over India, from all the toilets of the country, from all the sciences, that homeopathy is best possible assistance for child. So that's why this is our inspiration, that till date, since very beginning, early, I am telling you, I was student of 1970. From till date, homeopathy is rather proudly can claim that yes, we have to do many things for the children. Because of the reason the organs are very sensitive, hormones and other finer organs are growing. So there, on those situations, strong drug might give some iatrogenic effects for the children in long term. Moreover, as per the seminars of mother and child health campaign, we understood there are certain diseases, nothing can be done except operation, like congenital disease, like your anomalies, development anomalies. These type of diseases are only surgical necessity, only help, but homeopathy can do many things. In our opinion, I am having the records, I will be showing later, that atrial septal defect, ASD, can be completely cured, recovered by homeopathy without any single medicine, without any operation. So phallostatology, VSD, ASD, those are developmental disorder, can be finally fantastically controlled if the treatment starts from the very beginning. One more thing I learned, we learned from our teachers in Calcutta Homeopathy Medical College. I have told you before that whenever a child borns, just after they born, give one globulus of sulfur 200 to the child and other to the mother. This antisodic blockage will help child and mother from different critical diseases in the near future. That was routine given prescription of our teachers to our obstetric gynecology department to give sulfur 200. In due course of time, from research and my experience, I have seen that when you are not getting any clear-cut picture, when repertory is also constrained or not giving clear-cut pictures or patient is not improving, you should try once by thyroidinum for any congenital disease or developmental anomaly. Many cases starting from hydrocele, juvenile hydrocele, starting from juvenile hernia. I have seen number of cases, fantastic improvement, if not the only drug, but as intercurrent. So whatever, Amit has given many sources, fantastic literatures we are having. We can help those help, but we should remember that one child treatment, one child recovery means that child after throughout his life he'll remember you. That family will remember you because the child is most beloved and costly in the family, and one in the family will be your fan in the near future. You're not treating a baby, but you're treating an entire family along with the relatives. So you're having means, number of weapons. Please exercise and try. Thank you very much. Thank you all on screen out of screen.
Thank you, sir. Thank
Please.
Thank you so much, sir. We had learned a lot of additional inputs, and this is the additional benefits of the CME. Not only on the topic, but there are a lot of things which has been added by our beloved, respected Dr. Abhinandan Ganguly sir and our moderators through and through. And before we end today, we have another announcement regarding the alumni meet. That is, we are going to have exemplary awards for uh, Alumni Meet 2022. And for this, we have a committee to select. The nominations will be submitted by the alumnus of NIH from the NIH 12 batches, from BHMS 30 batches. 31st is undergoing intern. They will not be allowed to go for the, submit or go for the nomination. And for the MD 24 batches, the UG who are in MD 25th and 26th batch, they can submit their nomination. So on basis of that nomination, a committee had been formed, and that committee will be looking after the total number of nominations, and whoever being nominated, we are going to request them, the nominated personnel for the award, to submit your CV. And if you're interested to go ahead with this award, the coveted committee will be headed, is being headed by Dr. Ujjal Mondal, our ex-medical, former medical superintendent of National Institute of Homeopathy. And he has been assisted by our today's moderator, Professor Dr. Rajat Kumar Pal, then Dr. Pritha Mehra, Dr. Chandrasekhar Pure. We have Rajat, we think we have one more person. Dr. Associate Professor Dr. Afsar Ali, and we have our President Dr. Devnayan Kalyani sir and myself. These 7 people cannot be nominated on this exemplary contribution award. Apart from that, we have 3 respected persons whom we had awarded last alumni meet in 2022. From Dipanite, it was Professor Murugan. From BHMS, it was our beloved Dr. Pralay Sharma, whom we had awarded with the exemplary award in 22, is now the director of National Institute of Homeopathy. And from MD, it was Dr. Sandeep Kumar Mishra. Along with that, our committee of 2020, our committee of 2022 had given 2 awards to Professor Niranjan Mahanti and Dr. Sunimal Sarkar for their outstanding contribution for the propagation, growth, and popularizing homeopathy across the masses. So this has been a enormous work in the background going on with the teamwork of the respected alumni of NIH. Everybody is shouldering their responsibilities. My beloved brothers and sisters of National Institute of Homeopathy, please come forward and submit your nomination. You can find them in WhatsApp channel of National Institute of Homeopathy Alumni Association. You will find the link in the WhatsApp group and the Telegram group of National Institute of Homeopathy Alumni Association. And thanks for your patient hearing. I'll return to our backstage editor, Dr. Orko Mukherjee. Over to you, Dr. Orko.
Thank
And
you
good
and
night.
good evening, all of you. Many thanks. Please
Good
come
evening.
again.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed today's CME, do make sure to give it a like, share it with your fellow batchmates and also your fellow alumnus. And don't forget to just go and join our WhatsApp channel to get updated as soon as we schedule and other updates regarding Alumni Association and NIH. and also to keep posted about the daily meetings. For this is messages for the alumnus. If you want to get posted notified about the daily meetings or happenings, you can just join the WhatsApp group, or you may just join the WhatsApp channel. It's for all. It's not only for the alumnus. It's for all who are watching, alumnus and non-alumnus. The group is for all. Just for you to get updates and get notified about recent NIH alumni gatherings and etc. So we have our social media handle in the description below. Go like our page, follow our Instagram account, and also don't forget to subscribe this channel. Click on the all notification button to get updates as soon as we schedule over here too. So with this, it's me, Orko Mukherjee. Good night to all, and see you in our next CME.
This channel does not promote or encourage any illegal activities. All contents provided by this channel is meant for educational purpose only.